Do you have difficulty staying asleep through the night? Maybe you've lain awake worrying about tomorrow's presentation, or perhaps you wake up at 2 a.m. and can't haul back asleep. You're not alone. Millions of Americans struggle with insomnia, and many assume the only solution is medication.
My name is David. I'm a general practitioner working at Mayo Clinic in the United States. I've seen how sleep problems quietly undermine health, affecting everything from blood pressure and blood sugar to mental clarity and emotional resilience.
Here's what I want you to understand after reading this. Insomnia isn't just about being tired. It's often a symptom of underlying issues: stress, medical conditions, lifestyle habits, or even the environment you sleep in. And while medication has its place, there are evidence-based, non-pharmaceutical approaches that can address the root causes and help you reclaim healthy sleep. We're going to explore exactly how sleep works, what disrupts it, and the specific strategies you can implement starting tonight.
Before we dive into solutions, let's clarify what we're dealing with. Sleep disorders fall into three main categories: insomnia, which is difficulty falling or staying asleep; hypersomnia, which is excessive sleeping; and parasomnias, which include things like sleepwalking or vivid nightmares. Today, we're focusing exclusively on insomnia.
So, when does occasional poor sleep cross the line into clinical insomnia? In reality, we define insomnia as getting less than 6 hours of sleep per night, at least 3 times per week, and this pattern continuing for 3 weeks or more. If you're nodding along because this describes your situation, you're part of a much larger group than you might think.
The key question isn't just, am I sleeping enough, but rather, why am I not sleeping? This is where many people get stuck. They treat the symptom without addressing what's driving it.
First, psychological and stress-related factors. This is perhaps the most common culprit I see in my practice. You've got a major work deadline tomorrow, or an important meeting, or you're dealing with financial stress. Maybe you've experienced a traumatic event, the loss of a loved one, a divorce, a serious health diagnosis. Your mind simply won't quiet down. For some people, this evolves into chronic anxiety disorders, where the inability to sleep becomes its own source of anxiety, creating a vicious cycle. I've worked with patients who haven't slept well in years, all because they're caught in this pattern of worrying about not sleeping, which then prevents them from sleeping.
Second, underlying medical conditions. This is the category people often overlook, yet it's critically important. Certain health problems directly interfere with sleep. Brain injuries or neurological conditions can disrupt sleep architecture. Respiratory issues like sleep apnea or heart conditions like congestive heart failure can make lying flat uncomfortable. You feel short of breath, you have to sit up to breathe properly, and this repeatedly wakes you through the night. Joint pain and arthritis create a similar problem. You shift position during the night, your knee or hip flares up, and suddenly you're wide awake at 3 a.m. For women in their mid-40s to early 50s approaching menopause, hot flashes become a major sleep disruptor. You're sleeping peacefully, then suddenly you're drenched in sweat, your face is flushed, your heart is racing. It only lasts 2 to 5 minutes, but it completely fragments your sleep. Even after the hot flash passes, falling back asleep becomes difficult. Third, stimulants and substances. This seems obvious, but you'd be surprised how many people don't connect their coffee habit with their sleep problems. Caffeine from coffee, tea, energy drinks like Red Bull, these all contain stimulants that block sleep-promoting chemicals in your brain. Here's what many Americans don't realize. That energy drink often contains more caffeine than a cup of coffee. The peak effects of caffeine can last 4 to 6 hours, which means if you have coffee at 4 p.m., your brain is still processing it at 10 p.m. when you're trying to fall asleep.
And then there's alcohol. Many people think alcohol helps them sleep because it makes them drowsy initially. What actually happens is that alcohol disrupts your sleep architecture. You might fall asleep faster, but your sleep quality is significantly reduced. You don't cycle properly through the different sleep stages, particularly REM sleep, which is essential for mental restoration. I've tracked this myself using sleep monitoring technology, and the data is clear. Even one drink reduces sleep quality measurably.
You might sleep for 8 hours, but you wake up feeling like you only got 5 hours of restorative rest.
Fourth, sleep environment and sleep hygiene. Sometimes the problem isn't internal, it's your bedroom itself. Noise from traffic or neighbors, room temperature that's too warm, uncomfortable bedding, excessive light. All of these environmental factors can prevent quality sleep. Living near a train track or a busy highway creates chronic sleep disruption that people often don't even consciously register, but it fragments their sleep cycles throughout the night.
To understand how to fix insomnia, you need to understand how sleep works at a biological level. Your body operates on what we call a circadian rhythm, essentially a 24-hour internal clock regulated by light exposure and hormones.
The star player in this system is melatonin, a hormone produced by your pineal gland. When it gets dark outside, melatonin levels rise, signaling to your body that it's time to sleep. When it's bright, melatonin production is suppressed, keeping you alert. This is why jet lag is so disruptive. Your internal melatonin cycle is out of sync with the local time zone.
Here's the critical part. Exposure to bright light, especially early in the day, actually improves your nighttime melatonin production. When you see bright morning sunlight, your brain produces cortisol, which wakes you up. This daytime cortisol surge then sets up a stronger melatonin response when darkness falls. It's a beautifully coordinated system when it's working properly.
The problem is that modern life disrupts this natural rhythm. We spend our days indoors under artificial lighting, then stare at bright screens emitting blue light well into the evening. Blue light is particularly problematic because it mimics sunlight, tricking your brain into thinking it's still daytime and suppressing melatonin production. Your laptop, smartphone, and tablet are essentially telling your brain, stay awake, right when you should be winding down. Now that we understand the mechanisms, let's talk about solutions. These are evidence-based approaches you can implement at home, organized by which underlying cause they address. For stress and psychological factors, meditation and breathing exercises are remarkably effective. I'm not talking about anything complicated. You don't need to become a meditation expert. Simply sitting quietly for 20 to 30 minutes before bed, focusing on your breath, can significantly reduce the mental chatter that keeps you awake. Count your breaths. Breathe in, breathe out. That's 1. Breathe in, breathe out. That's 2. When your mind wanders, and it will, gently bring your attention back to counting. This practice lowers your body temperature slightly and activates your parasympathetic nervous system, both of which promote sleep.
For circadian rhythm optimization, get bright light exposure in the morning. Step outside within an hour of waking up and look toward the sun, not directly at it, but in that general direction. Let that bright morning light hit your eyes for at least 10 to 15 minutes. This resets your internal clock and primes your melatonin system for the evening. For elderly patients or people with mobility limitations who can't easily go outside, even sitting by a bright window can help.
In the evening, do the opposite. Minimize blue light exposure. Most smartphones have a night shift or night mode setting that filters out blue wavelengths after a certain time. On iPhone, you'll find this under Settings, Display and Brightness, Night Shift. Set it to activate automatically around sunset. For computers, you can install software that does the same thing. Even better, establish a true screen-free period in the hour before bed. Most importantly, maintain a consistent sleep schedule. Your body craves regularity. If you go to bed at 10 p.m. and wake at 6 a.m. every day, yes, even on weekends, your melatonin cycle will synchronize to that pattern. The first few nights might be difficult, but within 3 to 4 days, your body will adapt and falling asleep becomes dramatically easier. Inconsistent sleep times confuse your circadian system and make insomnia worse.
For medical conditions affecting sleep, targeted interventions can make a huge difference. If you have respiratory issues or heart conditions that cause shortness of breath when lying flat, elevate the head of your bed. Not just your pillows, but the actual bed frame. You can place blocks under the headboard legs to create a gentle incline of about 6 inches. This uses gravity to reduce fluid accumulation in your lungs and makes breathing easier.
There's also a specific technique called postural drainage that helps clear respiratory secretions. Lie on your back with pillows under your hips so your chest is lower than your abdomen. Breathe in deeply through your nose, hold briefly, then exhale slowly through your mouth. The exhale should take twice as long as the inhale. Do this for 3 to 5 minutes before bed. You can also lie on your side with a pillow under your hip, or lie face down with a pillow under your stomach. These positions help drain mucus from your airways, preventing the buildup that causes nighttime coughing and breathing difficulties.
For GERD and acid reflux, elevation is again your friend, but specifically elevate the head of the bed, not just pile up pillows. When you just stack pillows, you create a bend at your waist that actually increases abdominal pressure and can worsen reflux. A true bed incline keeps your esophagus above your stomach. Also, avoid eating within 3 hours of bedtime, especially fatty or spicy foods that slow digestion and increase acid production.
For women experiencing menopausal hot flashes, hormone therapy can be highly effective, but I'm talking about plant-based phytoestrogens rather than synthetic hormones. Supplements containing compounds like black cohosh have been shown in studies to significantly reduce hot flash frequency and severity, often within 2 weeks. During an acute hot flash, having a fan nearby and wearing moisture-wicking sleepwear can provide immediate relief. Keep your bedroom cool. Around 65 to 68 degrees Fahrenheit is ideal for most people anyway, and this helps minimize hot flash intensity.
For stimulant-related insomnia, the solution is straightforward, but requires discipline. No caffeine after 2 p.m. For some sensitive individuals, even that might be too late. You might need to cut off caffeine by noon. This includes coffee, tea, energy drinks, and even some medications that contain caffeine. Read labels carefully.
As for alcohol, if you're struggling with insomnia, I strongly recommend avoiding it entirely in the evening, or at least limiting consumption to earlier in the day. I know this isn't what many people want to hear, especially those who have a nightly glass of wine as part of their routine, but the sleep quality data is unambiguous. If you must drink, do so earlier in the day, and allow at least 4 hours before bedtime for metabolism.
For sleep environment optimization, there are several adjustments that make a measurable difference. First, temperature. Keep your bedroom cool. Most people sleep best when the room is between 60 to 67 degrees Fahrenheit, 15 to 19 degrees Celsius. Your core body temperature naturally drops as you fall asleep, and a cool room facilitates this process. Taking a warm bath or shower 60 to 90 minutes before bed actually enhances this effect. Your body temperature rises from the warm water, then drops more dramatically afterward, promoting sleepiness.
Second, consider using pink noise instead of trying to achieve complete silence. Pink noise is different from the white noise many people are familiar with. It has more low-frequency sounds, similar to steady rainfall, rustling leaves, or a gentle waterfall. Studies show pink noise can improve sleep quality by providing a consistent sound mask that prevents sudden noises from waking you. You can use a smartphone app, a dedicated sound machine, or even a small tabletop fountain in your bedroom. Third, invest in your mattress and bedding. If your mattress is more than 8 years old, or you wake up with aches and pains, it's probably time for a replacement. Your pillow should support your neck in neutral alignment, not too high, not too flat. The right choice depends on whether you sleep on your back, side, or stomach. For some people struggling with insomnia, supplemental melatonin can serve as a useful short-term tool, particularly when trying to reset their circadian rhythm. Melatonin supplements are widely available in the U.S. at most pharmacies without a prescription, typically in doses ranging from 1 to 10 milligrams. I recommend using it starting with a low dose, around 0.5 to 1 milligram, taken about 30 to 60 minutes before your target bedtime. Melatonin isn't a sedative, it's a signal to your body that it's time to sleep. It works by shifting your circadian phase, not by knocking you out. If you're trying to establish a consistent sleep schedule,
Taking melatonin at the same time each evening for 2 to 3 weeks can help entrain your natural rhythm. Once your sleep pattern stabilizes, you can usually discontinue it without problems.
The key concern some people raise is dependency. In reality, melatonin doesn't create the kind of pharmacological dependency that benzodiazepines or other sleep medications can. Your body produces melatonin naturally, and supplementing doesn't typically suppress your own production. That said, melatonin is a hormone, and long-term high-dose use hasn't been extensively studied, so I generally recommend using it as a tool to establish good sleep patterns rather than a permanent nightly supplement.
Here's what I really want you to understand. Chronic insomnia isn't just about being tired during the day, though that's certainly part of it. Poor sleep increases your risk of hypertension, type 2 diabetes, obesity, depression, and even cardiovascular events like heart attacks and strokes. It impairs your immune function, making you more susceptible to infections. It affects your cognitive performance, memory consolidation, and emotional regulation.
When patients come to me exhausted after years of poor sleep, often their first question is, "Can you just prescribe me something?" And I understand that impulse. They're desperate for relief. But prescription sleep medications, while sometimes necessary, come with their own issues: tolerance, dependence, cognitive side effects, and the fact that they don't actually address the root cause of the insomnia.
What I've shared with you today are strategies that target the underlying mechanisms of sleep disruption. They take more effort than swallowing a pill, yes. They require consistency and patience. You might not see dramatic results on night one, but when you address the actual causes, whether that's your circadian rhythm being out of sync, your bedroom being too warm, your evening coffee habit, or your unmanaged acid reflux, you create sustainable, long-term improvements in sleep quality without the side effects and risks of medication.
But for many people, perhaps even most people with insomnia, the combination of addressing their sleep environment, optimizing your circadian rhythm, managing underlying medical issues, and eliminating sleep-disrupting substances and habits will dramatically improve your sleep quality. You don't have to accept insomnia as your new normal. Your body wants to sleep properly. It's designed for it. Sometimes it just needs you to remove the obstacles you've unknowingly placed in its way.